see you busting those moves.
Welcome, everyone. I'm Sharon Fidarelli, Executive Director of the New Mexico Alliance of Health Councils, and I'm delighted to welcome you to the 8th Annual Public Health Day. Our theme for today is Racism is a Public Health Crisis, moving forward towards equity. This event is co-sponsored by the New Mexico Department of Health, the New Mexico Alliance of Health Councils, and the New Mexico Public Health Association. And we couldn't have had a better team to work together. So thank you for all of my team members for putting this together and working so hard to make a great event for today. Leah Sanchez from New Mexico Public Health Association will be my co-host today. And first, I want to say thank you to our public health partners who shared slides, and for Madeline, our executive assistant at the Alliance, for putting everything together and adding the energizing music. We appreciate the slides, and they'll be shown again at the close of the meeting if you missed them. They'll also be posted in the chat if you didn't have time to read all of the information about the organizations. I also want to recognize Presbyterian Healthcare Services. Since 2015, Presbyterian Healthcare System has provided financial support to county and tribal health councils and communities where PHS has hospitals as a demonstration of partnership with health councils to build healthy communities. And since 2015, PHS has also supported the New Mexico Alliance of Health Councils to advocate for, build capacity of, and sustain health councils throughout New Mexico. When combined, this general support totals about $1.2 million. We wouldn't be here if PHS wasn't here, and so I just wanted to take a minute to express our gratitude publicly. Today, you'll notice a few different things about Zoom. You can have transcriptions as an option if you want to see closed captions. We also have Marcella, who will be doing Spanish translation, and you can access that by renaming yourself and writing the word PIN afterwards. Marcella, would you like to also give instructions in Spanish, please?
Yes, thank you, Sharon. Buenos días a todos. Mi nombre es Marcela Salmón. Yo seré su intérprete en español el día de hoy. Para poder accesar la interpretación, en el fondo del lado derecho de los iconos que ven en su pantalla de Zoom, después de que yo termine de dar esta explicación en español y en inglés, aparecerá un globo terráqueo, un icono. Al darle clic en el icono, van a poder ver que pueden elegir el canal del idioma en el cual quieren escuchar lo que se está comentando. So just to repeat this in English, as soon as I'm done giving these instructions, you will see a globe icon appear in the lower right-hand side of your Zoom screen. When you click on it, you will have the option to select what language you would like to listen in. So if there's any Spanish content and you would like to listen to it in English, you would just click on the English icon, although I don't believe that will be the case today. Thank you.
Thank you, Marcella. We also have American Sign Language translation, and if you need ASL, you can just put ASL after your name, and you should be able to spotlight, well, I'm not sure what the term is, but you'll be able to see the ASL interpreter. Today's event is first starting with a virtual press conference where you'll hear from leaders in the state who are working hard to end racism by building health equity for our most vulnerable population. And after the virtual press conference, at the end, you'll have a chance to meet some of our organizations who are leading the charge in standing against racism. And then in the afternoon, after a short break, you'll have an opportunity for a land acknowledgement workshop. So please stay with us as long as you can. We do have a break built in if you need to go get a quick lunch. But next on our agenda is a land acknowledgement that will be led by my co-host, Leah Sanchez from Public Health Association.
Thank you, Sharon, and thank you all for being here today with us. I'm honored to read our NMPHA Indigenous Peoples Ancestral Lands Acknowledgement Statement. We ask that you pause to reflect on, acknowledge, and honor that we in New Mexico, even in this digital space, are on the homelands of the Diné, Pueblos of Acoma, Cochiti, Isleta, Jemez, Laguna, Nambe, Okeowinge, Picuris, Poake, Sandia, San Felipe, San Ildefonso, Santa Ana, Santa Clara, Santo Domingo, Taos, Tesuque, Zuni, and Zia, the Jicarilla Apache Nation, the Mescalero Apache Tribe, and the Fort Sill Apache Tribe. Indigenous peoples comprise 14.5% of New Mexico's population and experience the highest rates of health inequities and poverty conditions. Despite the fact that many of our indigenous communities were forcibly removed from their homelands through genocide, religious inquisition, and ethnic cleansing, indigenous peoples are still here, persisting and resisting through ongoing colonialism and oppression. We see you, we hear you, and we are committed to continue addressing systems of oppression that inhibit health equity in the state of New Mexico. Established in 1917, the New Mexico Public Health Association emerged as one solution to mitigate the health needs of the state. Today, Indigenous people continue to be afflicted with the highest rates of health disparities. NMPHA recognizes that the data shows Indigenous peoples are not benefiting from healthcare services or live in a region that supports their health needs. The NMPHA board will strive to elevate the health of Indigenous people by establishing and nurturing relationships with tribes, tribal entities, health councils, and members, advocating for policies and legislation with communities that address land, air, and water rights, supporting and promoting tribally led health initiatives, addressing opportunities to deconstruct structural racism, racial bias, and systemic inequality and oppression, and by providing technical and educational opportunities through conferences and forums. Indigenous peoples have and will continue to lead and teach that the well-being of the land is connected to the well-being of our spirit. It is the embodiment of our physical and mental health. As relatives on this earth and to the original caretakers of this land, we must aspire and acknowledge the cultural ways of knowing and wisdom that Indigenous peoples live and practice since time immemorial. Through these efforts, the New Mexico Public Health Association is reminded that this land acknowledgement will serve more than a performative gesture in the healing process of Indigenous people. We honor our ancestors and our grandchildren of tomorrow.
Thank you so much, Leah. I think that's so important to make time to recognize where we are. And I appreciate you sharing that. We're moving to our keynote speakers today, and we are so honored to have Dr. Grace and Dr. Patahone with us today. Our pandemic is escalating, and I know that their time is at a premium, so we are so grateful that they've made time to share their words with us today. Dr. Grace currently serves as the Cabinet Secretary for the State of New Mexico's Human Services Department and as Acting Secretary for the State Department of Health. Dr. Grace has been an integral part of the state's COVID-19 response, now overseeing the state's testing, tracing, vaccine distribution, and variant sequencing efforts at the Department of Health. So two of our largest, most complex departments. It's a huge reach in the time of a pandemic, and we are so grateful for your leadership, Dr. Grace. You're making a huge difference in our state and in our communities. I also want to also introduce Dr. Perahon at this time because she'll follow Dr. Grace. Dr. Perahon is our Deputy Cabinet Secretary for the Department of Health, and she's known for her heart for those who are most vulnerable. She's led our COVID work throughout the state with both integrity and great compassion. Drs. Grace and Dr. Perahon are a great team and have done an amazing job in navigating a long and extremely challenging pandemic. Please join me as we welcome Drs. Grace and Dr. Perahon to speak to us today.
Well, I've got to say it's a great honor to be here, and appreciate you all having me here today. I have a message for you from the governor, but I'm going to wait to a certain slide to tell you what it is. So don't mute me just yet. And Laura and I are going to divide up the work today. We were asked to talk about how do we care for public health workers, and I'm going to take that one. And then we're going to move into the theme of the conference today, which is how do we combat and actually change New Mexico into a state that finds the solution or solutions, I should say, to systemic racism. And so I think I'm going to just go to my first slide. I was really moved and touched by the land acknowledgement. I was in Vancouver in 2019, and we had they did a land acknowledgement everywhere you went there. It was really great. And so we brought that back to HSD, and all of our slide presentations, no matter where we give them, include the land acknowledgement. And now we're doing it by a vote of the leadership team to do it at DOH as well. We had a photo contest to see which employee could come up with the best picture. This one won just last week. And so, but I found that by doing this land acknowledgement in every meeting, that now when I look out my window or I'm driving up to Santa Fe or whatever I'm doing and just see how beautiful of a place we live in, I automatically am reminded and express my own thankfulness to the First Peoples who were here for making this wonderful place for us. And I do acknowledge everything that was said in that in the previous and better, more complete land acknowledgement, because those are real problems that we face here in our state. Next slide, Brianna. I want to wish everyone a happy Lunar New Year. Today is that day. We have a new moon today. This year is the year of the tiger. I want to thank BC Wind for preparing this for us as well. And if you're celebrating, may your new year be filled with energy and a sense of adventure. And if you're not celebrating, may your new year be filled with energy and a sense of adventure. Next slide, please. It's also Black History Month. And I think one of the things we can do to really confront racism is to normalize the importance and contributions of every culture that we have in our country. And so we're working at DOH on taking a lead role in trying to sort of promote more of these sort of statewide or national or international events here in our own state. And so we wanted to remind everyone of another thing that we begin celebrating this week and today. Next slide. The first thing that I did when I got to DOH as the acting secretary in July was to organize a strategic planning retreat. And we worked on some fairly significant revisions to the DOH mission and goals. And with health equity at the forefront, and with a focus, as you can see, on goal 4 about supporting each other and focusing on our employees. And that's the part I'm going to talk about just briefly today. So next slide, please. Our values, we added health equity as our first and primary value at DOH. We know that's a value of all of you here today. So we're excited about that. I mean, I'm going kind of fast and you won't have time to read all these because what Laura has to say is more important than what I have to say. And she has way more slides than I do. So next slide, please. And you know, our definition is that health equity means that everyone has a fair and just opportunity to be as healthy as possible. And we are now officially identifying all those obstacles in our state. And I've been working on poverty in the state for a very long time in my career, and now as HSD secretary and DOH acting secretary, but power imbalances, systemic racism, discrimination, and all the things that those things do to prevent people from having a fair and just opportunity to be as healthy as possible. And Laura's going to drill down into that to a great degree. Next slide, please. I wanted to let you know that we're proud of the makeup of our HSD employee, DOH employee workforce. And you can see 61.3% of all employees are, I self-identify as Hispanic, Latino ethnicity. You can see the other statistics here, but we think to be an effective Department of Health in promoting equity, we need to have a workforce that looks like New Mexico. I understand that I don't help that very much. And so it's my job to make sure we get lots and lots of people working in our department that really do help that. Next slide, please. I wanted to talk about this. And the CDC, if you didn't see this study, published a survey of public health workers across the United States, a huge survey, 26,000 public health workers, and 53% of them reported that in the previous 2 weeks, they'd had a symptom of either depression, anxiety, PTSD, and suicidal ideation. And if you read into the article, that's like 8.4% of public health workers now 15 months into the pandemic. Actually, the survey was done in March, so 12 months into the pandemic when they surveyed them, 15 months when they reported it. 8.4% actually thinking seriously about ending their own lives. Well, 8.4% of the DOH workforce is 250 employees. So we've taken that very, very seriously. And when I was talking on the phone to the governor just an hour ago, told her I would be meeting with all of you and talking briefly to you. She wanted me to express to you all her heartfelt thanks. She's aware of this data. She knows the kind of personal sacrifices everyone has made to help us fight this pandemic, all the extra hours worked, and wants you to know that she is just very, very deeply grateful for every partner that helped us, every individual in New Mexico who has helped us and is helping us fight this pandemic. Next slide. It's useful if you have like, if you have the ability to access data about your employees. Look at the blue is the number of overtime hours worked by the public health department in state fiscal year 21, July 2020 to June 2021. And so we've done a good job cutting down on that overtime there. You can see just huge numbers of hours, average of 20 extra shifts in all of the non-facility places. And, that's like 1 out of every 5 weekend days, 20 shifts. Next slide. On the facility side, it was even more impactful, 60 extra days worked in a year. So that's really more than 1 weekend day per week worked. And that takes its toll. And when you combine this extra work and the stress of the pandemic, those CDC numbers make sense. But it's really important that we take care of ourselves. Next slide. And so one of the things we're doing in DOH is we've put some work groups together of DOH employees to advise leadership on how do we address issues around recovery, having the resources we need to continue to fight this pandemic and keep up our work. How do we recognize employees for the hard work that they've done and for helping us so much? And how do we remember we've lost a fair number of people when you have 3,000 employees? That's enough to have deaths from COVID and a lot of family deaths from COVID as well. And how do we remember that? So we're also doing monthly employee meetings to try to normalize this idea that we're suffering and that we've had a hard time getting through this pandemic and trying to find ways to give people strength. We're making holidays again. What a concept, like not holidays where you work giving vaccines on Christmas or doing nasal swabs, but holidays where you spend time with your families. And so now DOH for state holidays is on holiday. And of course, we have to have skeleton crews, like maybe in the lab or in EPI or other places. But we're really trying to work on our own health. And that's really my message for you today. Before I turn it to Laura, is we have to take care of ourselves, and we have to fill our own buckets first in order to take care of New Mexico for the second and third and fourth parts of this pandemic. Next slide. I think that might be it for me. I'm so privileged to work with Laura. I tell her almost every day how much I appreciate the work she does. She's an incredibly hard worker. Her whole life has been devoted to equity. We're just so privileged to have her as the Deputy Secretary of the Department of Health. And she's going to talk more about racism. There are some questions in the chat, and I don't know how we're going to handle those, but the state doesn't close schools, just for that one question. The state uses relies on the school districts to close McKinley County schools. So that's up to them. Okay, Laura, on to you.
Thank you so much. Thank you so much. It's such a privilege to work with you too, Dr. Grace, as being under you, and also the opportunity to be under Tracy Collins as well. Dr. Tracy Collins, it's a privilege really to serve the state and work alongside all of you and the people at DOH. So thank you for all you're doing as well to make it better for all of us. So thanks. I'm just going to share a little bit about COVID disparities and advances in health equity that I was asked to share. So next slide. Great. So I think for us at the Department of Health, it's really important, and I know for all of you, to recognize that there have been certain groups that have been disproportionately affected by COVID. You can see here nationally, American Indian, Hispanic, and Black race ethnicity had a higher risk for COVID-19 hospitalization and death during the whole pandemic. Next slide, I'll just show you some New Mexico slides and go through those quickly. Higher levels of poverty also are related to higher rates of hospitalization and death. Next slide. American Indian, Hispanic, Black populations, you can see here, these are also groups that have been disproportionately affected as well, if you look at our data that we have every week at the Department of Health. Next slide. And same with higher rates of death. Next slide. Great. And what we're seeing is that our life-saving, vaccine actually has a lower rate of vaccine uptake for Hispanic, Latino, and Black populations, and it's especially marked for 5 to 11-year-old groups. Next slide. So we see this as, like a clear marking that racism is a public health crisis in our state as well as in the country. Next slide. And I think a really great way to understand this, I got this from the Racial Equity Institute, but when you look at one fish in a lake and you say, well, why did that fish die? Maybe you think they just died of COVID, that individual fish, especially as clinicians, yeah, that fish died of COVID, Next slide. But then when you look at the fish and you actually notice that around that fish, like half the fish are dead belly up, then you have to wonder if it's actually the water that's causing you to die and not necessarily just the COVID. Next slide. And so that's why we think of it like, well, it's just not that one lake that had half the fish dying, it's multiple lakes. And maybe it's the groundwater. And so that's the metaphor that the institute, the Racial Equity Institute, uses to describe systemic racism as a public health crisis. We're not just looking, we're just not just looking at the individual as an individual discrimination issue. We're looking at the whole system, health systems, educational systems. What are all the systems that contribute to people dying in this world? Next slide. So declarations of racism as a public health crisis at the national level really has to do with systemic racism. What are the situations as institutions that actually are causing certain groups to die more than others or disproportionately affected? It's been declared in many states and cities, and thank you so much to the New Mexico Public Health Association for really having this time to declare this as a public health crisis. It's an opportunity for us, I believe, at the Department of Health, working with all of you as partners to address systemic racism and do actual strategic actions. Equity in all policies for future policies and program. Really appreciate the fact that equity is in our mission statement and is in the work that we're trying to do. And then the areas of strategy have been in data and accountability, community engagement, policies and program, and also importantly, funding. Next slide. So examples of what we have already done together for COVID equity, we did get a lot of funding from FEMA and CDC to address things together. Next slide. Equity in COVID vaccine testing and treatment. So our public health division and epi response division, like David said, have been out there on Christmas, on holidays. We partnered with all of you, state agencies, community orgs, nonprofits, to really organize a COVID response. We've addressed equity by looking at data by race, ethnicity, poverty, and gender, using the social vulnerability index to allocate appropriately, and then working with community health workers, health promotions, all of you to develop materials such as this, like vaccines are free. A lot of the data that you shared with us said that people were concerned that it wasn't free. So that became part of our messaging. Next slide. And then, free home test kits. We've actually partnered recently with the Rockefeller Foundation, and there's a link on our website that people in certain zip codes can get even more tests than others. So just trying to address equity that way as well. Next slide. And then improvements that you see in our vaccine equity program, trying to listen to what all you guys are saying and trying to implement programs to address that. Next slide. Same with mobile teams. We've really gone trying to get mobile teams out there working in partnership with all of you. Next slide. And then here's some CHW trainings that we've been doing weekly, really to address misinformation and also share information to the community, such as like right here with oral medications. We've really made efforts to address equity in trying to get medicines to people who need it. Next slide. And then the data that you see on our website with disaggregated data by race, ethnicity, poverty, gender, all this is in these weekly reports that our amazing EPI department and our public health division do together to make this happen so that people can find out how to address this. So this to us is like a really great, this is just in the COVID world, but what's our opportunity to work together to address racism as a public health crisis? So these next slides I'll go through quickly. Next slide. We have equity embedded in the 10 essential public health services that the CDC has. Is what is public health? There's these public health services and equity is in the middle. Next slide. The Public Health Accreditation Board also has equity as their key framework. And so New Mexico is part of trying to get accredited every year. So we do have a current accreditation and we're moving towards the next phase, which is really focused on equity. Next slide. And then we have a House memorial that's convening a public health task force that many of you have been on and been a part of to improve public health infrastructure with also an eye for equity. Next slide. And so our next steps are really to be like, these are sustainable pieces, what is public health? What's the public health infrastructure look like? Next slide. And so we really want to work with you all as partners to address racism as a public health crisis, working with all of you to actually develop concrete actions and accountability. I really appreciate Dr. Grace for saying, how are we reporting this? How are we really actually keeping accountable to an anti-racist health equity approach in data, community engagement, planning, policy, workforce, and also really declaring racism as a public health crisis with very concrete steps forward as a community that we can work towards. So that's sustainability, like I shared, having 10 essential functions, accreditation to support that. And then also the Primary Care Council has a component working on equity as well. And then the funding that we're currently getting from the CDC, but hopefully work towards having legislative support for all this work. So thank you guys so much. It's such an honor and privilege to work with all of you guys and just work towards an equitable approach to health together. So thank you.
Thank you, Dr. Grace. Thank you, Dr. Patajon, for your leadership. And we so appreciate all of your contributions to this event and all you're doing for New Mexico. I'm delighted to introduce next Geraldine Antonio, the Tribal Liaison for the New Mexico Alliance of Health Councils.
Thank you, Leah. Thank you for the introduction. Yat a she Geraldine Antonio Yinshe, Nanished Ejetachini Nishle, Tobajna Aje Bashishin, Ashihe Dashinele Ado Glashe Dashiche, Aquit Ego Stanishle. Greetings, my name is Geraldine Antonio. I am the Charcoal Streak Division of the Red Running Into the Water. I'm born for the two who came to the Water Clan. My maternal grandfather's clan is the Red Bottom People Clan, and my paternal grandfather's clan is the Salt Clan. I am a proud Diné woman of the Navajo Nation, and it is with great pleasure to serve as the tribal liaison with New Mexico Alliance of Health Councils. I'm honored to join you today as we recognize Public Health Day and the many heroes who are making a difference as we are moving towards equity and stamping out racism in our communities. It is a critical time, which needs all of us to act with commitment and dedication. The pandemic has highlighted the impact of structural racism among our vulnerable and marginalized communities. And the New Mexico Alliance of Health Councils is working with public health state partners to address racism as we increase access to vaccine and to testing. And as we are moving towards equity, health councils have begun to plan for COVID recovery, but also addressing community health priorities in our state. And I would just also love to mention that, health councils have served a significant role in our public health workforce. They have been the local arm of our state's public health system since 1991. And after being severely funded for over 10 years, it's amazing to see how our health councils have mobilized quickly during the pandemic. With training and technical assistance provided by the Alliance, health councils are building their capacity to serve and support their communities. From the rapid deployment to emergency preparedness teams, to the distribution of food and household items and PPE, and to the rapid planning of vaccine testing in clinics, health councils have shown up in big and small ways, and we are forever grateful for that. So health councils carry such a daunting responsibility, and they continue to make positive impacts in our communities across the state. I'm also eager to announce that the Alliance has been working effectively to engage with tribal communities, nations, and pueblos, and we continue to learn more about their undeniable resilience and strength. Since June of 2022, we have formed new partnerships with 4 pueblos and numerous tribal leaders. There has been an increase in requests for county to tribal introductions and joint efforts. So building tribal relationships is so important for us, and it's critical to addressing racism as a public health crisis. So we're looking forward to our future partnerships and collaborations, but also working with our tribal partners as they build resources to address community public health needs in their communities and serving their people. And also, in addition to all the wonderful work happening with health councils, the tribal engagement happening in our outreach to tribal communities, health councils have been deeply involved in capacity and advocacy building programs. So I'm just going to share 2 programs that are currently happening right now within the Alliance. So the first is the Culture of Health. We have 7 county and tribal health councils who are currently participating in the program. And this has been funded by the Robert Wood Johnson Foundation. And the Culture of Health is designed to develop skills around community health planning, stakeholder engagement, policy and advocacy skills. So these skills support the comprehensive community health planning legislative mandate that has been given to our health councils. So some examples as part of the program that health councils have begun to implement some of those policy action plans. They range from cultural and language revitalization among Native youth, access to transportation, zoning to prevent adolescent tobacco intake, and crisis intervention for mental health responses. So as you can tell, there's been a lot of work happening at a policy level for health councils under the Culture of Health program. And the program has been going really great. So it's really great to see the progress our county and tribal health councils have been making with this specific program. And also the second one I would love to share with you all is the vaccine equity and community rebuilding program. So this was awarded to the Mexico Department of Health, funded by CDC and the Kellogg Foundation. And through this program, health councils have begun to improve vaccine equity through prevention, education, testing, and clinics. And a lot of this targeted with their local communities and populations. So as part of this process as well, health councils have formed health equity committees. So these health equity committees are established to ensure that the state's most rural and vulnerable community members are served, as well as recognizing and understanding community, racial, and health inequities. That's just year one, but as we shift to year two, a lot of it will be focused on community rebuilding and advocacy development, and all will be provided by training and technical assistance. So kind of just to end on a good note, with the leadership and guidance from our executive director, Sharon Finarelli, and our newly hired staff, the Alliance has also been prioritizing equity, inclusion, and diversity also at an organizational level. We've established a racial equity design group, and this has been focused on the revision of practices, policies, and structures. So, this group is designed to center equity at the core of the Alliance and all that we are involved with, but also most importantly to ensure that the efforts are sustained at an organizational level, but also for our health councils. And I would just like to close by saying that by harnessing the collective strengths of our health councils and statewide health partners, we will help serve New Mexico's communities as agents of change. The Alliance expresses gratitude to our county and tribal health councils. Your courage and commitment has not been overlooked in the hearts of those you have touched and helped. For this, we thank you and commend you.
Thank you so much, Carolyn. We're honored to have you as a member of our team. And next up is Dr. Denise Herrera, Executive Director of the CONALMA Health Foundation. For 2 decades, CONALMA has had the privilege of supporting nonprofits and change makers that share the goal of advancing health equity in New Mexico. Please welcome Denise Herrera to share with us on the topic of philanthropy and equity.
Thank you, Sharon. Good afternoon, everybody. In the United States, Black women are 3.5 times more likely than white women to die during or after childbirth, regardless of education level. So, a Black woman with a PhD is 3 to 4 times more likely than a white woman with a high school diploma to die. The elevated risk of maternal mortality for Black women for multiple causes reflects the impact of structural racism on health and healthcare in the US. Multiple factors contribute to these differences, of course, including variation in quality healthcare, underlying chronic conditions, structural racism, and implicit bias. Historically, many people from racial and ethnic minority groups have not had fair opportunities for economic, physical, and emotional health. Beyonce and Serena Williams have been open about their own childbirth experiences and poor follow-up care. If negative and scary experiences can happen to Beyonce and Serena, international figures who presumably can afford the highest quality medical care, then these negative outcomes can happen to just about anybody. We can't educate our way out of this problem. We can't healthcare access our way out of this problem. There's something inherently wrong with the system that's not valuing the lives of Black women equally to white women. So addressing these stark racial disparities requires fundamentally reorienting the current approach to health and healthcare. Research and action should be grounded in the understanding that racism is at the root of health inequities. We must first ask, how do systems, policies, and social structures combine to create the conditions for poor health? Rather than asking, what's wrong with people of color that makes them die younger at higher rates and with more illnesses? Closing the gap involves addressing structural racism. That is, those aspects of social, political, economic, and healthcare systems that reinforce inequity. At CONALMA Health Foundation, health equity and systemic change have always been top priorities since our inception more than 20 years ago. Rather than placing blame on individuals or their behavior, we question what inequities or social injustices exist within systems and structures where individuals and communities live, work, and function. In philanthropy, we should be supporting conditions that help people and communities thrive. Rather than perpetuating the existing systems that were designed for some people to fail, we should tackle root causes. I often say, in philanthropy, our goal shouldn't be to fund food pantries. Our long-term goal should be to solve hunger. But how do we do that? To address racism as a public health issue, the philanthropic sector should address the inherent power imbalances that exist between funders, nonprofits, and the communities they serve. Being a trust-based funder requires constant and continuous examination of those power imbalances and biases that exist in our day-to-day decision-making, culture, and practices. When we don't do that, we run the risk of reinforcing or even amplifying inequities in our grant making and causing further harm to communities that have often been overlooked by philanthropy. So my call to action is actually for funders. Here's 5 things that funders can do to address racism as a public health issue. 1, recognize that racism is a public health issue. We as funders must hold this at the center of every discussion about our community investments and community engagement strategies. 2, invest in community-led solutions to address health equity. We must nurture relationships in communities that are hit hardest by the outcomes of racist practices. And we must follow communities' lead and support solutions designed by and with them. 3, support equity-centered data collection and more targeted research. This should include sufficient funding to collect data for groups that are often left out of data collection, such as people with disabilities or small immigrant communities, for example. Disaggregated data by race, place, sexual orientation, and other factors is slowly becoming available from public systems and is leading to alarming findings about the disparate outcomes for underserved communities. While there's growing agreement about what's needed, change requires redesign of data infrastructure and data sharing systems, so foundations should support that. And 4, adopt a health justice in all policies approach. A health justice approach combines a social justice lens with an approach to health that considers the complex and interwoven social determinants of health. And 5, support anti-racist research. Anti-racist research is grounded in the understanding that racism is a fundamental cause of health inequities. Among other things, anti-racist research requires that we lift up the voices of those closest to the pain, and it reframes research questions that often begin with the premise or assumption that there is something wrong with people that makes them sick. So the imperative here is pretty clear. To advance health equity, we must name and address the historical and contemporary underpinnings of those realities. And advancing health equity here in New Mexico requires full participation by each one of us. This is our collective work. Thank you for including us today, and thank you for all the work you do every day.
Thank you, Dr. Herrera. I'm honored next to introduce Dr. Tracy Collins, the Dean of the UNM College of Population Health. Dr. Collins is playing a critical role in building our public health workforce in so many ways, not least of which is her leadership in as the movement to establish a school of public health for New Mexico that is deeply collaborative and serves the depth and breadth of New Mexico's communities. Thank you, Dr. Collins.
Thank you, Leah. It's my pleasure to be here today. I want to just take a little trip back and have us go through our history. Back in 2020, we saw the devastation of COVID-19 and its horrific impact on communities of color and indigenous communities. We also saw more police violence and social injustice. We saw the murder of George Floyd. We did see justice with a conviction for Derek Chauvin, but we also saw an increase in hate crimes against Asian Americans. We then saw another death, Dante Wright. We then saw another conviction of Kim Potter. What do we do with all this information that's so negative? So as Martin Luther King said, darkness cannot drive out darkness. Only light can do that. Hate cannot drive out hate. Only love can do that. And as our former president said, change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. So I'm going to charge you, what can you do? And I'm going to use myself as an example. What have I done and what I'm going to do moving forward? So I moved to New Mexico to serve as a dean for a new and growing college of population health, the second of its kind in the country. I have great faculty to work with, great students, but we need to grow. We have an anti-racism initiative, and we need to continue to put efforts toward that. But we've got to grow our faculty and our students, and we've got to do more in the state of New Mexico. I also assisted with overseeing reopening of the university when we were hit by COVID. And then, as you know, I stepped in to serve as Secretary of Health during the vaccine rollout. So those are things I've done. What am I going to do now? So we have Senate Bill 119. We have an opportunity to do something great in this state that has been under-resourced for too long when it comes to public health. It is time to more than double our student body. It is time to grow our faculty so that we can become an accredited school and a school of public health. And it's also time to increase our space. We are spread out across the university, and we really are busting at the seams. It is time for the new building. What are we going to do with the School of Public Health? We're going to substantially increase our research funding to support interdisciplinary work in the areas of violence, social justice, diabetes, obesity, mental health, substance use, and climate change, just to name a few. We have an opportunity to create and sustain a Center for Latino Public Health, a Center for Native American Public Health, a Center for African American Public Health. And so these are the things I have my eyes set on, and I'll be taking many trips these next few weeks to Santa Fe to make sure that we can get support for Senate Bill 119. And I encourage you to do the same. COVID is just one small piece of what we're dealing with in this country and in the state of New Mexico. We can do so much more for our community members, rural, urban, by really addressing public health. So I'm going to give you one last quote from our former First Lady. History has shown us that courage can be contagious and hope can take on a life of its own. I'm going to ask you to be courageous and get behind me with Senate Bill 119. Even if that doesn't make it, get behind me and let's get public health going in the state. Thank you.
Thank you so much, Dr. Collins, and what a great reminder that with all of the evidence around us showing what underfunding public health does, to see a solution in sight, to see the opportunity to rebuild and to strengthen communities through strengthening public health is refreshing, and it's a great charge to all of us to look for ways that we can support that legislation to make public health what it should be in our state. Thank you. So our final speaker before our breakout sessions is Anna Rondon. Anna Rondon is co-president-elect of the New Mexico Public Health Association, and she is a dedicated lifetime advocate for rights of the indigenous people. For the past 50 years, Anna Rondon has worked alongside many influential indigenous leaders and her own spiritual advisors, which has deeply rooted her in how to navigate movement building at various levels of organizing for change and justice. Please join me in welcoming Anna Rondon to speak with us on policy and equity. Anna.
Oh, Yate, greetings everyone. Wasn't this a great morning, afternoon? With all these great speakers, geez, it's a great motivator. My name is Anna Rondon, and I am the project director for the New Mexico Social Justice and Equity Institute, but I also serve as the co-president-elect for the New Mexico Public Health Association. And it's an amazing learning experience, and I'm so fortunate and very humbled to be part of this great group of public health advocates throughout the state. As we also, I wanted to recognize that the Western Hemisphere and other indigenous peoples around the world have the longest standing health care and public health system through our medicine ways and through women healers. That sustained us for thousands of years. So we must have been doing something right. And as we see this country crumbling before our eyes, the chaotic process that we are all going through is part of the change. And the words that you're hearing, the truth telling, is also part of the healing that we need internally as well. So public health started originally in Europe and was imported here through different experiences of physicians, doctors, philosophers back in the 1500s, 1600s. I know the roots of public health in America, so I'm trying to braid the two of indigenous thought and public health as we have it today. But as our previous presenters spoke on how the disparities, the blatant racism that has exasperated these past 3 years, it's very overwhelming. And it's through groups like these that come together, the younger generation, bringing new talent, new ideas, while they listen to the elders of the New Mexico Public Health Association, the professionals, the medicine people that are working in the hospitals, the doctors, the nurses. We need those positions to reflect the people of New Mexico as well. New Mexico Public Health Association has been working very hard on social determinants of health, environmental health and justice, universal health care. And those three goals is what we strive for. And some of those actions that we've done the past couple of years in working with our different partners throughout the state on the Health Security Act is one that we are having a collaborative impact on policy, healing policy. Also the uranium cleanup issues have been taken into a public policy realm with the New Mexico State Legislature from organizations like the Multicultural Alliance for Safe Environment, who have been impacted by the uranium industry and the nuclear beast that is among us. And also years ago, when we were learning about New Mexico Public Health Association, we attended conferences, but we didn't feel welcome at all in those settings in Albuquerque. But today, through organizations like Strong Families, Bold Futures, Multicultural Alliance for Safe Environment, Tewa Women United, I also want to recognize Kathy Sanchez, Elder Kathy Sanchez, for working up in the Northern Territories and sensitizing the people for so many years, living in and about around Santa Fe, that house, that roundhouse, where her people also were hung and murdered in the gallows. Public health is also about healing, centered within us, and as we turn outwards to the world and to the universe. It's about healing, it's about patience. New Mexico Public Health has reached out to other people of color and indigenous people you wouldn't see this agenda full of people of color on this afternoon's agenda. It wouldn't have been here 30 years ago or even 20 years ago. I'm so thankful for the leadership of the policy board, all of the strong leaders within the New Mexico Public Health Association, and partners like New Mexico Alliance for Health Councils. Those are the arteries and the bloodstreams for our healing, getting more resources to the counties, to the 33 health councils in New Mexico. The people on the ground need the resources, braided with the professionals. And also public health is a science and even an art to community organizing. We all have a time to learn together as we learn as in humanity. The ones that know the truth and the light of what Martin Luther King was speaking to, we carry that torch and we carry it so that the future generations will light and keep that fire of racial justice and healing for the next generations. And with that, thank you to all the beautiful speakers. Thank you for this beautiful day. And I just want to remember that roundhouse. Say it with me. Whose house?
Our house.
Our house. Yeah, thank you.
Very powerful.
Thank you so much, Anna. I know Madeline's working on unmuting so she can give us directions for our breakout rooms. We understand that we're over time a little bit. If you need to leave at 1, that's great. Thank you for your time. And if you're able to stay, Madeline's going to give direction for breakouts. Madeline?
Hello, everybody. Yes, I'm going to give some instructions for the breakout sessions. And we had a suggestion to do 2 breakouts instead of 3. So I think we're going to go ahead and do that. You'll still have the opportunity to attend whichever organizations you want to attend, but we'll have 2 5-minute sessions instead of 3 5-minute sessions just to respect your time a little bit more. So I'm just going to pull up a screen here with some instructions on that. Okay, so these are the organizations that will be featuring in today's networking breakout sessions. I'll also, I think somebody is going to post in a chat this list, so I won't share it on the screen here for a second. You should be able to see it though in the chat with a little bit more information as well. So how this is going to work is we're going to split the next section of time up into 2 sessions. The first will be networking breakout 1, and you'll be randomly assigned into one of the breakout rooms featuring one of the organizations on the previous slide, and that will last for 5 minutes. Then we'll have 1 minute of transition time, and you'll see a chat from me when it's time for that to happen, and so that you can switch sessions, and you'll head to networking breakout session number 2. And for that one, you'll have a choice of which session you want to go to, and I'm going to show you how to do that in a minute, but that session will also last for 5 minutes, and then we'll come back to the main session after the second networking breakout. Okay, so I wanted to give you a little kind of screen share of how this will work. Basically, for the first room, you'll get an invitation to join the room. You can just click join and you'll go into the room. For the second time, what you're going to want to do is you're going to want to find this breakout rooms box in the bottom part of your toolbar. If you don't see it right away, there might also be a little 3 dots box in the bottom of your toolbar, and you can click on that, and then you should see this little four boxes. It won't show up yet since we haven't opened the breakout rooms, but it should show up in just a minute. Once you click on that box, it will open this window and you'll have the option of which room you want to join. Not quite all of our organizations are listed since we recorded this before we had the full list. So just note that there'll be a couple more. So then you can click join for the room that you want to attend, and you will be able to enter that room. Just a little bit of information about what your screen will look like when you're in the breakout room. This in the top corner, you're going to see what the name of the room that you're in, so you know where you're at. In the bottom right, you're going to see the option to leave the room. If you click that, you'll come back to the main session, and I will be there to troubleshoot if there's any technical difficulties. And then finally, if you want to switch a breakout room, once again, you'll use this little 4 boxes down in the bottom part of your screen. And that when you click on that, it's going to pop up this little window, and you should just click on choose breakout room. And then you'll get this same window that pops up again, and you can choose which breakout room you want to move to for the next session. Okay, so that's just a brief overview. This is the session descriptions for everybody to see. In a minute or two here, you should see an invite for the breakout rooms pop up on your screen. And I haven't quite seen the chat. I don't know if somebody has been able to post the session descriptions in the chat. If not, we will get that added.
It has been done. It's been posted twice, and we'll keep doing.
Great. Okay. All right, so I'm going to stop sharing my screen here, and I think that we're going to be opening up the breakout rooms in just a second here.
Yes, just for the tech support folks, is somebody doing it, or would you like me to do it? It may take us a moment to make sure everyone's in the right place, but I'm going to go ahead and create it, okay?
Yes, please.
Are you
I
ready?
don't know where to go.
Again, just to reiterate, the first session is going to be random. It may take us a moment to make sure the leader's in the right place. After that, you'll be able to choose. And there'll be somebody here. Madeline's going to stay in the main room to help out those people, but go where you're sent. It'll be great.
Okay.
Okay.
Well, it looks like folks are coming back to the main room from the breakout rooms. I know virtual has its challenges, and we really appreciate everyone for hanging in there. It's a great way to be together during Omicron and make things accessible. And also there are a few little snafus depending on Zoom and your connection. So we're grateful for all of your patience. And in closing, I want to remind folks that at 2 p.m. will be our Principles of Meaningful Land Acknowledgements for Non-Native Led Organizations, led by Sheena Tallis-Tallman, our NMPHA co-secretary who developed NMPHA's land acknowledgement. And in closing, I'd really like to lift up all of the partners and organizations that have been instrumental in making this declaration of racism a public health crisis in New Mexico for years. There just have been so many folks and so many organizations who we have learned from. And I want to especially lift up the Deconstructing Racism New Mexico Coalition. They've been working on it for many years. Right now in the leadership of Together for Brothers with Christopher Ramirez and Baruch Campos, we've made a lot of strides. I want to thank also the Ophelia Hudson and Christina Morris with the Global Campaign Against Racism, also Reina and Oriana with the Global Campaign Against Racism in Southern New Mexico, Jesse Espinosa Jensen with the Health Equity Partnership. I want to say how much we've all learned from Dr. Corinne Sanchez with Tewa Women United. And I also want to lift up the important contributions of Christopher Hudson with the McKinley County Health Council. I know that health councils all over are involved in anti-racism work. And I just want to say that Christopher in particular is part of the Deconstructing Racism group and gave important input into the declaration of racism as a public health crisis. I want to also lift up Professor Margaret Montoya, Professor Emeritus from UNM, for her important contributions. Also the UNM Tree Center, led by Dr. Lisa Kokari Stone and Dr. Nina Wallerstein. I want to acknowledge the contributions of Karen Katira from UNM for supporting the Deconstructing Racism New Mexico group for so long. I know NACA Inspired Schools is part of that group. I want to also acknowledge the enormous contributions of Dawn Hunter from the Network for Public Health Law, Tia Taylor Williams from the American Public Health Association. And in lots of ways, we've learned so many important things from Catherine McGill from the New Mexico Black Leadership Council. And these are just a few of the groups who we are grateful to learn from and partner with every day. I also want to lift up Anna Rondon, the Executive Director of the New Mexico Social Justice and Equity Initiative and our incoming co-president. She gave really important contributions to our declaration that sort of inspired today's theme. And we're just so grateful to learn from the work of people of color in New Mexico. And we continue to want to partner and are grateful for all of your contributions. So thanks to all of you for contributing to today's theme. And we're excited to reconvene at 2 p.m. for the Principles of Meaningful Land Acknowledgements for Non-Native led organizations. Thank you, everyone.
We can all unmute and say thank you, really. What a beautiful thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
What an amazing, amazing experience.